Good day, my student. Today I'll lecture about pathogenic spirochetes. Classification of spirochetes. Order spirochetes includes two family Spirochetaceae and family Leptospiraceae. Family Spirochetaceae include two genus treponema and genus Borrelia. Leptospiraceae family includes Leptospira. You see different morphological characteristics of treponema, Borrelia, and Leptospira. Disease caused by spirochetes. We will study genus treponema species pallidum, causative agent Syphilis, Borrelia, genus Borrelia, causative agent Borrelia recurrentis, disease, epidemic relapsing fever and endemic relapsing fever, and we will study Borrelia burgdorferi, causative agent Lyme disease, and genus Leptospira. We will study species Leptospira interrogans, causative agent leptospirosis disease. Morphology spirochetes. Spirochetes are slender unicellular helical or spiral rods with a number of distinguished ultrastructural features used in the differentiation of the genera. They are gram-negative and are 0.1 to 0.3 micrometers wide and 5 to 215 micrometers in length. They are structurally more complex than other bacteria. The spirochetes have a gram-negative type cell wall composed of an outer membrane, a peptidoglycan layers, and a cytoplasmic membrane. Morphological classification of spirochetes by number of curls and color after staining by Giemsa. Genus Borrelia, number of curls 3 to 10. And after Giemsa staining technique will have blue or violet color. Genus treponema, number of curls 8 to 12, and the color after staining by Giemsa pink. And Leptospira genus, number of curls more 20, and a color after staining by Giemsa red. Spirochetes, they differ from other bacteria that they have flexible cell wall around which several fibrils are wound. These fibrils turned as endoflagella, axial filaments, or periplasmic flagella. These endoflagella are polar flagella wound along the helical protoplasmatic cylinder between the outer membrane and cell wall. On the slide you can see structure of flagella, structure of spirochetes, excuse me. You can see spirochetes, Borrelia, Leptospira is not important because structure and spirochetes and Borrelia and Leptospira will be same. Endoflagella, axial filament, cell membrane, periplasmic space, and outer membrane, like gram-negative microorganism. Mortality of spirochetes, flexion and extension of cells, corkscrew-like rotary movement around the long axis, and translatory motion from one side to another side. Method of staining spirochetes for microscopic examination. We will use Giemsa or Rites. In Russian Federation we use Romanovsky Giemsa staining. Some species stain blue, other blue-violet, and still other pink. But you have to remember about Borrelia can be visualized using aniline dyes, Rite or Giemsa staining in light microscopic due to size. You can use silver impregnation method, Levaditis stain, or by Morozov stain. Spirochetes look brown on the yellow background. Treponema and Leptospira is visualized by dark field microscopy or direct fluorescence antibody microscopy. And Graham's method is used for staining saprophytic species gram-negative, pathogenic representative are not staining well by grams. On this slide you can see different methods of staining. For example, this dark field microscopy, immunofluorescence method of study, Leptospira, impregnation of silver by Morozov-Levadin's test, and Gimza staining technique. The main distinguished features of Borrelia, treponema, and Leptospira. Taxonomy. First, we will explain about Borrelia. Order Spirochetes, family Spirochetaceae, genus Borrelia, and species Borrelia recurrentis. Causative agent, epidemic relapsing fever, and another species of Borrelia, causative agent, endemic relapsing fever, and Borrelia burgdorferi, causative agent, Lyme disease. Morphology of Borrelia. Borrelia are chemical organisms. They are gram-negative, motile, and possess 5 to 8 irregular spirals. Spirals are coarser and more irregular than of the treponems or leptospirs. Can be seen with light microscopy in impregnation of stain by aniline dyes. You see Borrelia, such as Wright's or Gimza staining. You can see Borrelia violet color, and dark field microscopy. Microorganism Borrelia do not form spores and capsules. On this slide you can see aniline. You can see Borrelia after staining aniline dyes. On this slide, aniline dyes. This slide same but large. Cultural characteristic. Borrelia are microaerophilic. Optimum temperature for growth is 28-33 degrees. Cultivation is difficult but has been in complex media containing serous fluids. The organism can be grown on noguteous medium, aesthetic fluid containing rabbit kidney, and modified Calis BSK medium after incubation for 2 weeks or more. Borrelia you can cultivate in a chicken embryo. Antigen structure. Surface proteins antigen present in all Borrelias. Variant-specific antigens and antigenic variation have been shown to be caused by DNA rearrangement in liner plasmids present in Borrelia. Pathogenicity factors or virulence factors, endotoxin because it's gram-negative microorganism, lipopolysaccharide. Borrelia recurrentis expresses a multifunctional surface lipoprotein turned like HCPA that exploits the host proteins and offer resistance to complement attack and opsonization while increasing the potential to invade the host's tissue. Factors of adhesions, surface proteins and structure, height motility, and antigenic mimicry or antigenic variation, ability of Borrelia to undergo antigenic variation, meaning that once the innate immune system is able to identify and start fighting off the first antigenic type, another antigenic type appears. Resistance. Lack of stability in the environment, sensitive to heating, ultraviolet, and antibiotics. In the soil and water at low temperature up to 2 months. Relapsing fever is an arthropod-borne infection, and 2 types of which occur loose-borne and tick-borne infection. The Borrelias causing them are same in morphology and many other features but differ in their arthropods host. On the slide you can see different type of Borrelia, which cause different type of infection, have different reservoir and different vectors. For example, Borrelia recurrentis cause relapsing fever epidemic or loose-borne relapsing fever, reservoir human, and vectors body louse, pediculus humanus. Borrelia subspecies, Borrelia, for example, Dutoni and another species, cause relapsing fever endemic or tick-borne relapsing fever, reservoir, rodents, soft-shelled tick, and vectors Ornithodora subspecies. And Borrelia burgdorferi causative agent Lyme disease, reservoir rodents, deer, domestic pets, hard-shelled ticks, and vectors Ixodes tick, but Ixodes subspecies. Epidemic or loose-borne relapsing fever causative agent Borrelia recurrentis. You see violet color because after gram staining or after Giemsa staining technique you will see violet or blue color of Borrelia. Epidemic or loose-borne relapsing fever causative agent Borrelia recurrentis. It is an exclusive human pathogen, being transmitted from person to person through body lice, pediculus humanus corporis, and disease is found worldwide. Humans are the only reservoir for Borrelia recurrentis. It is an obligate human pathogen, first observed by Obermeyer in 1873 in the blood of patients during epidemic in Berlin. Epidemiology. Source of infection a sick individual. Vectors body louse, head louse. Modes of infection transmission. Infection is transmitted not by the bite of lice, but by the being crushed and rubbed into abraded skin. Borrelia recurrentis is not transmitted transovariously in lice. Next, on this slide you can see body lice, which will be vectors and vectors for transmit to sick individual, from sick individual to health individual. Pathogenesis and clinical features. The agent get into the lymphatic systems, are engulfed by phagocytosis, multiply, get into blood, and part of them die, releasing endotoxin. Primary period of fever 7-10 days, affect vascular endothelium, and clinical symptoms hemorrhagic infraction in the liver, spleen, and meningitis. In a few days, antibodies are produced and Borrelia die. This is period of temperature normalization 4 to 10 days. Part of Borrelia survive and produce a new generation, junior antigenic generation. Their exist into the blood pool triggers a secondary period of fever. Attacks may recur up to 7-10 times. And on this slide you can see temperature of patient and reason of this temperature: high temperature, low, increase, high temperature, decrease temperature, low temperature. This antigenic ability of Borrelia forming antigenic variation impairs the host immunity system from being able to clear the infection and explains why there are multiple recurrences of fever. Microbiological diagnosis. The test material: blood during fever, bone marrow during remission. Because of the difficulty of culturing Borrelias and the serological test due to antigenic variation, laboratory diagnosis of relapsing fever depend on demonstrating the spirochetes in peripheral blood either in the living state or after staining. Relapsing fever, causative agent endemic or tick-borne relapsing fever, causative agent Borrelia dutoni, Borrelia hermesi, Borrelia parkeri, and then etc. The second form of relapsing fever is endemic and tick-borne. It is causative agent by as many 15 species of Borrelia and cause endemic relapsing fever, and is spread by infected soft tick of the genus Ornithodorus. Natural host for this organism includes rodents and other small mammals on which the tick normally feed. Epidemiology: this disease zoonosis, source of infection of wild and cynotropic animals, vectors tick of Ornithodorus gender. Modes of infection transmission: transmissive via bite, not via crush, via bite. After bite, human can infected Borrelia dutoni. Next, species of Borrelia: Borrelia burgdorferi, causative agent Lyme disease. In 1977, an outbreak of borreliosis in the town of Lyme, and in 1981, Burgdorfer discovered the causative agent. Epidemiology. For example, the nymphal ticks molt to adult stage with field mates on large mammals and lice age. Age heads into infected larval tick. Borrelia burgdorferi is acquired by the larval tick when feeding on an infected small mammals. The larval tick moves to nymph. After that, nymph can bite human and can cause Lyme disease. The disease is widespread. There is not most common vectors-borne infection. It is caused by Borrelia burgdorferi, transmitted by the bite of Ixodes ticks. Borrelia burgdorferi is highly invasive but doesn't produce any toxin. Lyme disease pathology is generally thought to be the result of host inflammatory response. There is substantial genotypic variation among Borrelia burgdorferi strains, and evidence suggests that certain strains have a greater probability of causing disseminated infection. Borrelia burgdorferi produce several adhesions that mediate bonding to decorin, fibronectin, other glycosamine glycans, and integrins. Infection induces the synthesis of a variety of pro-inflammatory and anti-inflammatory cytokines and chemokines by host immune cells. That includes a type 1 interferons response that seems to depend on the genotype of the infecting Borrelia burgdorferi strain. The spirochetes can evade the host immune response by resisting to complement-mediated killing facilitated by factors H-bonding proteins and by antigenic variation. Stage of Lyme disease. Stage 1. Early localized clinical symptom target rash, flu-like symptoms. Stage 2. Early disseminated clinical symptoms: swollen lymph nodes, secondary annular skin lesion, bell palsy, headache, meningitis, extreme fatigue, conjunctivitis, and other clinical symptoms. And stage 3. Late persistence clinical symptoms: arthritis, immune complex mediated reaction. Stage of Lyme disease. Lyme disease may be progressive illness and is divided into 3 stages. I told about it previous slide. Laboratory diagnosis. Wet preparation. The Borrelia has been isolated from tick as well as from skin lesions, cerebrospinal fluid, CSF, and the blood of the patient. Microscopic technique we will use, dark field microscopy. Serological tests such as ELISA and immunofluorescent test have been described, and immunoblotting recommended for confirmation. Antibodies take after 1-2 months to appear. And PCR method, detection of Borrelia DNA in tick and patient blood. This slide you can see stage, clinical stage, early localized, migration erythema, common flu symptoms, and arthritis and specific clinical symptoms. Specific prophylaxis and treatment have not been worked out. Treatment tetracycline, chloramphenicol, penicillin, and erythromycin are effective. Next, spirochetes, treponema pallidum, causative agent Syphilis disease. Taxonomy. Order Spirochetalis. Family Spirochetaceae, genus Treponema, from Greek trepo, rotate, nemo, filament. Species Treponema pallidum. Treponems cause the following disease in human. Treponema pallidum, subspecies pallidum, cause venereal syphilis. Treponema pallidum, subspecies endemicum, causes endemic syphilis. Treponema pallidum, subspecies petunia, causes yaws, and Treponema carateum causes pinta. Different subspecies Treponema pallidum cause different disease. On this slide you can see Treponema in tested material, dark field microscopic you can use, and immunofluorescence microscopic technique. Morphology. Treponema pallidum, very delicate spiral filament forms, coils which are comparatively small, sharp, and regular. Besides the typical forms, treponema may be seen as granules, cysts, L-forms, and other structure. The organism stained pale pink with the Giemsa stain. A typical representative is the causative agent of syphilis, Treponema pallidum. You see pale pink color of treponema. The structure of treponema, this common structure for another spirochetes. Tinctorial features. Treponema pallidum cannot be seen under the light microscope in wet films, but can be made out by negative staining with Indian ink. Its morphology and motility can be seen under dark ground or phase contrast microscope. It does not take ordinary bacterial stains, but stains light rose red with prolonged Giemsa staining. It can be stained by silver impregnation method, and you can use immunofluorescence method can now be used to detect treponems in tissue and body fluids. On this slide you can see Treponema pallidum smear staining by silver impregnation technique, Fontana stain, showing the spiral morphology. This method study of Treponema pallidum, immunofluorescence methods on dark field, you can see colorless spiral forms of microorganisms. Cultural features. By type of respiration of the microorganism, microaerophils, optimal temperature for cultivation 35 degrees, pH 7.2. This microorganism, Treponema pallidum, doesn't cultivate to nutrient media because treponema pallidum lose pathogenic virulence properties, but grows well in rabbit testicles and chickens' embryos. Antigenic structure. The antigenic structure of treponema pallidum is complex. Treponemal infection induced at least 3 types of antibody. On the basis of this antibody, the treponemal antigens may be divided into non-specific and specific antigens. Non-specific antigens. The first is the reagent antibody as known as cardioleum or cardiolipid, cross-reactive, common to human and cattle. This lipid base has been detected in treponema pallidum. And specific antigen, group-specific antigen proteins, and species-specific treponemal antigens polysaccharide. It's used as antigen for detection of species-specific antibodies. Factors: pathogenicity or virulence factors, toxins, endotoxin, lipopolysaccharide of cell wall, enzymes of pathogenicity, hyaluronidase, and structure and chemical compounds of the cell, motility, adhesions factors, proteins of external membrane, and an opposition factors to phagocytosis and forming cysts, L forms, and forming another morphological characteristics. And molecular mimicry, you know about it, its ability of forming antigenic variation. Resistance: sensitive to ultraviolet, drying out procedure, drying out procedure, high temperature, disinfectant solutions, salt of heavy metals, antibiotics, and freezing procedure for 1 year. Treponema pallidum subspecies pallidum causative agent Syphilis is a chronic infectional venereal disease characterized by a Y-form course when periods of clinically manifested activity alternate with protracted latent period. Historical reference: Syphilis appeared in Europe at the end of 15th century after the discovery of America Christopher Columb. In 1905, Schudin and Hoffman discovered treponema pallidum, and in 1906, Wassermann discovered serological reaction for syphilis diagnostics. Epidemiology: syphilis is anthropozoonosis disease because source of infection sick individual. There is no bacteria carrier state in syphilis. Modes of transmission: contact with sexual, household community, transfusive, and vertical with transplacental from mother to infant. Entrance gate: mucous membranes of the genitals, of oral cavity, and skin lesions. Incubation period 3 to 4 weeks, maximum 19 days. Stage of disease: primary stage, clinical symptoms you see on this slide, method of laboratory diagnosis, fluorescence microscopy of lesion. 15% of patients will be negative by non-specific serology reaction of Wassermann for study cardiolipin antigens antibody. Secondary stage, you can study clinical symptoms and method of laboratory diagnosis, serological technique, non-specific and specific, and both serological technique will be positive. Latent stage, without clinical symptoms, method of laboratory diagnosis, serological technique. Tertiary stage, forming gumans, syphilis, granulomas, aortitis, central neural system inflammation, tapes dorsalis. For clinical diagnosis, you will use serological technique, specific test, non-specific test, study cardiolipins antibody will be negative. And congenital syphilis, babies or during drug using. We will use serological test, should revert to negative within 3 of birth if infected. On this slide you can see explanation what does mean primary syphilis, secondary syphilis, tertiary syphilis and congenital syphilis, and what test you will use, clinical symptoms and test you will use for diagnosis stage syphilis disease. Pathogenesis and clinical features. I explained about it, I will not repeat. I hope you will read and will understand about clinical symptoms. And I want to explain you about congenital syphilis. Infection transmitted from sick mother to fetus. Includes 2 stages, early congenital syphilis and late congenital syphilis. Late congenital syphilis characterized Gensingson triads, keratitis, barrel-shaped teeth, deafness and supple shins. On this slide you can see Gensingson triads. Microbiological diagnosis. The test material, surface of ulceration, erosions, punctate of lymph nodes, liquor, cerebral spinal fluid amines, and blood. You will use bacterioscopic technique for primary and secondary syphilis investigation, dark field and phase contrast microscopic. You can use staining by Giemsa, pink pale color, and silver plating and direct immunofluorescence. This dark field microscopy, phase contrast microscopic, and this immunofluorescence microscopic technique. Silver plating, brown color on surface, yellow field. Diagnostic test for syphilis. We will use 2 groups of main groups test, demonstration of treponems in the exudate, and you will use different type of microscopic technique, different method staining, and a serological technique, enzyme immunoassay, and for study DNA you will use polymerase change reaction. And serological test, we know that treponema pallidum contain treponemic antigens and non-treponemic antigens. And we will study antibody against specific antigens and common antigens. I will not explain, you will see, for example, non-treponemal test, Wassermann complement fixation test, Cachen flocculation test, venereal disease researching laboratory test, rapid plasma reagent test, toluidine red enhanced serum test, and treponemal test. Group specific test using cultivated treponema rater strain antigen. Specific test using pathogenic treponems. Immunity. Post-infectional immunity, cellular and humoral, non-sterile, of a short duration, hypersensitivity of the light type develops. Specific prophylaxis and treatment have not been worked out. Treatment: penicillin is the drug of the choice for treating infection with treponema pallidum. In patients with allergic reaction to penicillin, erythromycin or tetracycline, may be used. And next, last microorganism which we study, Leptospira. You see red color, Giemsa staining, red color. Taxonomy. Order Spirochetes, family Leptospiraceae, genus Leptospira, from Greek leptos, thin, spira, spiral. Species Leptospira interrogans, pathogenic cause infectional disease, and Leptospira biflexa, saprophytic microorganism, and never cause infectional disease. Important leptospiral disease depend from serotype of Leptospira interrogans. For example, Leptospira interrogans, species Leptospira interrogans, classified by serotypes: Enterohemorrhagia, disease in human well disease, source of infection rat urine water; Canicola serotype, a disease of human Canicola fever, source of infection dog urine; Batavia serotype, Leptospira interrogans, causative agent Indonesian well disease, source of infection rat, etc., etc. Species Leptospira interrogans, and different serotype of these species. Leptospirosis is an acute native focal infection disease characterized by intoxication, wire-formed fever, damage of blood capillaries, kidney, liver, central nervous systems. It is accompanied by Jones and hemorrhagic syndrome. Historical reference: Inada, Hübner, and Ullengut discovered the causative agent in 1915 years. Morphology: thin, twisted filaments. Pearl necklace observed in smear. Have a primary and secondary helix. Secondary helix have S or C-shaped forms of microorganism. You see primary helix like pearl necklace, and secondary helix do not form spores and capsule and highly motile. On this slide you see primary helix, and secondary helix. Tinctorial features: poorly staining with anilinic dyes, gram-negative, Giemsa staining red color, silver plating brown color, negative staining by Bourrigens, and dark field and phase contrast microscopic you will use for laboratory diagnosis. Leptospira, for example, on the slide you can see Leptospira interrogans, serotype Enterohemorrhagia, silver staining of organism, grown in culture. Notice the tightly coiled body with hooked ends, like letter S. Cultural features: facultative anaerobes by type of respiration, temperature for cultivation 28, 13 degrees, and pH 7.2 to 7.4. Cultivation duration 3-7 days. Undermining to nutrient media, increased humidity of media, hydrophiles. Liquid media you will use for cultivation of Leptospira, liquid media with added rabbit serum, and you can use semi-synthetic medium such EMJH. Colorless, flat disc on solid nutrient media. No visible changes on liquid nutrient media. The specific cultural features. Biochemical features: hypoactive. Means have low biochemical activities. And about antigenic structures: genus, species, somatic antigen is present in all members of the genus. Classification into serogroups and serotypes, now referred to as serovariates or serovars, is based on surface antigens. 38 serogroups and over 100 serovars Leptospira pulmono, Leptospira gryptifosa, and Leptospira intergemorrhagi, etc. we know. Pathogenicity factors of virulence factors. Toxins factors, endotoxin, general intoxication, hyperpermeability of vessels. Toxin substance of protein effect, cytotoxin effect, and hemolysins cause hemoglobinuria, jaundice, and anemia. Enzymes, fibrinolysins, plasma coagulase, and structure and chemical cell components, adhesions, and motility. Resistance. Stable in the water of open reservoir, in the frozen state, and after first freezing. Sensitive to heating, drying out procedure, disinfectant solution, ultraviolet, and antibiotics. Epidemiology. Leptospirosis, zoonosis disease, because source of infection and native reservoir, small mammals. Rodents are chronic carriers, excreted with urine, and another mammals depend serotypes. Mode of transmission, urina, oral, via water, contact, alimentary. Related to occupation, seasonality very often spring, summer, and entrance gate, skin lesion, intact mucosa of gastrointestinal tract, mucosa membrane of the eyes, and urogenital organs. Pathogenesis and clinical symptoms. Phase 1. First phase, 7 to 12 days, incubation phase, invasion of the causative agent into lymph nodes and blood, primary asymptomatic bacteremia and dissemination of the causative agent. Phase 2. Secondary bacteremia, penetration of Leptospira into the organs, liver, kidneys, lungs, meninges, and other. And clinical symptoms, fever, headache, muscular pain, and common flu symptoms. Phase 3. Toxic capillarotoxosis. You can see clinical symptoms like hemorrhagic syndrome, jaundice, disorders, uropoiesis and urination, and meningitis. Phase 4. Formation of non-sterile immunity with a long lasting in the kidney. And phase 5. The body gets free from the causative agent. Immunity, post-infectional immunity humoral, stable, tense, long-lasting, strictly type-specific. Microbiological diagnosis. The tested material blood on the first 5 days, urine from day 8, cerebrospinal fluid, blood serum from 5 to 7 days, water of open reservoirs, parenchymatoses organs of the rodents. You can use for study of Leptospira. You will use bacterioscopic technique, crushed blood drops, specimen, and you will use dark field microscopy. Serological reaction agglutination lysis, gold standard, the microscopic agglutination test with museum strains of leptospirosis. Bacteriological technique, but very difficult for cultivation, and complex nutrient media you will use for cultivation of microorganism Leptospira. Biological technique, you will infected sensitive laboratory animals, guinea pig, and molecular biological technique for study DNA, genetic material, DNA of Leptospira. On this slide you can see principle of agglutination and lysis test. On first pictures you can see free Leptospira appearance by 1 by, and 4 to 5 test you see interaction between different Leptospira. This interaction with native Leptospira from blood or another liquid of your patient and museum species. You see agglutination reaction, interaction between museum serotype and serotype of your patient. Treatment of leptospirosis: antibiotics, doxycycline and penicillin G. Prevention, isolation and treatment of infected animals reduce the risk that they may spread the infection to contacts, and prophylactic treatment with antibiotics can be used to prevent disease in exposed animals. Today our lecture is finished. Don't forget to take the computer test in your personal account. Thank you for your attention.